Okay, I'm Dr. Az, and this is a new station in critical care. This station shows in the MRCS Part B, OSCE, okay, and it is not acceptable to fail this station. It is a long station, but it is a very important station. And we are going to discuss it here. You are going to know all the questions that are going to show and all the answers that you need to say to get the full mark or pass this station with a high mark. Okay, so first of all, let us go to the stem or the scenario. Okay, the stem will be written or put outside on the door, and there is a copy inside. It will say that there is a post-op patient. Okay, and this post-op patient is complaining of pain. Well, and on the drug chart, this patient has Panadol or paracetamol and arcoxia. Okay, you know that arcoxia is the selective COX-2 inhibitor. So this is the stem, just like that. So the examiner will ask you the first question. You have only 9 to 10 minutes here. So he will ask you to define pain. Okay, and to define pain, you want to mention the definition as I will tell you here. Okay, the acceptable definition is that pain is an unpleasant sensory or emotional experience that's associated with actual or potential tissue damage. Okay, again, it is an unpleasant sensory or emotional experience associated with actual or potential tissue damage. This is the definition of pain. Okay, well, next question. Question 2. They are going to ask you, how will you manage the patient after seeing the drug chart? And this is from the stem. This patient has pain. You have seen the drug chart. You knew the drugs, which are paracetamol and this arcoxia. So what is your management? Management of post-operative pain patient is according to the care for the critically ill surgical patient. When you say that, care for the critically ill surgical patient protocol, when you say that, you got half of the marks. Only these two words. Okay, now you are going to talk about the second half, and it's about the details. Okay, so you are going to use this protocol, and this protocol is an A, B, C, D, E protocol. Okay, so we are going to go through these, and first of all, you are going to check the airway. Okay, check the airway. If the patient is speaking to you, so his airway is patent and everything is fine. So for the breathing, you are going to check the respiratory rate. You are going to check the depth and pattern and pattern of breathing. Okay, Why? Because this will tell you if the patient's respiratory function is impaired or not. If he has inadequate analgesia, he will be in pain, and if it is a big operation, abdominal operation, for example, and he has pain, he will not breathe well. So from the depth button, he cannot take a deep breath, and the button will be shallow. So you want to know, this will give you an indicator, okay? And you are going to check if the patient can cough or expectorate. Please cough. He will not be able to cough if he has severe pain. Then after that, you are going to go to the circulation, and in the circulation, your major indicator, your major parameter here is tachycardia, okay? And you want to know that tachycardia is not always because of pain, because this is a post-op patient, and maybe he has hemorrhage, and this may be a part of a hemorrhagic shock. So you want to exclude that first, okay? And after that, you are going to see if this tachycardia is due to pain or not. So you want to exclude other causes, and after that, you can consider pain as the reason for the problem. The second thing here you want to consider in the circulation is that if his tachycardia is due to pain, this patient has a risk of myocardial infarction, okay? So you want to consider these three things here. First of all, it is due to pain. Second of all, it is due to shock. And third, it may cause or lead to myocardial infarction. So the fourth part here in the protocol is the disability. Okay, so you are going to assess whether the method of analgesia is contributing to the patient's clinical deterioration. Okay, you want to see if the patient, for example, has loss of consciousness, or the patient has any other abnormality that is affecting his level of consciousness. This most probably is due to opioid toxicity, or opioid toxicity. Okay, so if the patient is unable to move and unable to talk comfortably and so on, so you want to consider that this is an inadequate analgesia situation, right? So the D will tell you also some information about the situation of the patient. Finally, you are going to go to the E, okay? And in the E here, we are going to take another page because there are many points that are important about the E here. Okay, E is exposure, and exposure in the protocols, all the protocols or most of the protocols is considered for examination. Okay, but before that, you are going to think about if the patients, if pain relief is felt to be contributing to the patient's deterioration. Okay, so is the analgesia or pain relief is analgesia either adequate or not, is contributing to his deterioration. Okay, you want to review the chart, the drug chart, and you did that already, but you want to review it as a part of the protocol. Okay, you want to see if is the analgesia is effective, and is the effective analgesia is prescribed. So first here, effective analgesia prescribed. This is the first question you want to ask yourself. The second question, which is the fourth point in exposure and full patient assessment, okay, examination, assessment, call it whatever you want to call it. The second question here is that, is it given or not? Is the analgesia given? Maybe the nurse responsible did not remember for any reason, crowdiness, anything. So you want to know that. And the third question you want to ask yourself in the exposure, and the fifth point in the exposure part, the E part of the protocol, is if the treatment is appropriate. Okay, appropriate. So these are the 5 steps. According to that, you are taking history, you are doing systemic examination. You can go to your investigations. You can do ABGs. You can do a chest X-ray, no problem. But you want to, first of all, in exposure, and please focus in this, you want to know if the analgesia or pain relief is contributing to the patient's situation. Okay. Number 2, you want to look at the drug chart. Number 3, you want to ask yourself, is the effective analgesia is prescribed? Number 4, you want to ask yourself, is it given? And you want to ask your staff also. And finally, you are going to treat, is treatment is appropriate? Is this analgesic given and the management of the patient is appropriate for him or not? Okay. After finishing this step here of the protocol, now you are going to decide your plan. Okay. All this will be said in the answer of the second question. Okay. So be professional, please. You are going to see, number 1, if the analgesia and pain relief are adequate. So if they are adequate, nothing to be done, and you are going to continue in your management. Okay, as same as before. You are going to seek for another reason, but if it is adequate, that's okay. Okay, so if it is the problem, if the analgesia is inadequate, if the deterioration of the patient and the pain and the tachycardia are due to pain now, so you are going to ask the questions that we mentioned before. You are going to ask why it is not adequate. Okay. You are going to ask, is it due to failure of the method? Okay. And is it due to the incorrect implementation? Incorrect implementation of the chosen method. Okay, this number 3 here. Fine. And if the patient is developing any post-op surgical complications. Okay. And the 5th point is that you are going to contact the MDT multidisciplinary team. Fine. And this is also, in some places, it is replaced by acute pain services. And in this case, you already decided that analgesia is not adequate. So when you contact the MDT or the acute pain services, you want to tell them that you want to tell them the answers, why it is inadequate, and is it the failure of the method, and is it due to incorrect implementation of the chosen method, is it due to surgical post-op complications, and then they will try to discuss and give you an answer. They may ask you within this question, who is in the multidisciplinary team, pain multidisciplinary team, who is there, okay? And you want to know that there will be a surgeon because he did the operation and cut the skin of the patient. The anesthetist is also there because he is a part of the operation, and a nursing staff will be there, a senior nursing staff, or a pain management staff, nurse, maybe, or pain specialist, and a pharmacist who gives the medications. So these 4 people will be here. Okay, so the surgeon, the anesthetist, the nursing staff, and the pharmacist are the people who represent the multidisciplinary team of pain. Okay, so he is going to ask you the third question: what are the side effects of opioids? Okay, fine. And there are many complications. Actually, we can mention some of them here. The first of all, you do not want to have a respiratory depression. So the first complication of opioids is respiratory depression. Okay, sorry, my daughter with me, that is why. Anyway, the second point of the side effects of opioids is confusion. You can't remember any of them, he will stop you, the examiner, okay? Number 3, hypotension. Okay. Number 4, nausea and vomiting if you want. Okay. And pinpoint pupil. Also itching, if you want, constipation. All these are opioids side effects. Okay, so respiratory depression or apnea. Okay, confusion, hypotension, nausea and vomiting, pinpoint pupil, itching, and constipation. Okay, so I'm going to see you in the next session of this long station. Thank you.